Darius. I'm the executive director at Florida Voices for Health, and I'm based in Gainesville, Florida.
I'm Sarah Holland. I'm the CEO of Virginia Health Catalyst, which is from the fabulous Commonwealth of Virginia.
Hello, my name is Michelle Gross-Panico. I work with Dignity Health at Chandler Regional Medical Center and Mercy Gilbert Medical Center in Arizona.
My name is Katie Andrew. I work for Children Now here in California.
My name is Zil Joyce Dixon Romero, and I'm with the National Rural Health Association in their DC office.
Our mission at Florida Voices for Health is really to elevate the stories of people who are dealing with the healthcare system in one way or another. It's really to capture how difficult it is to access different programs, what's working well, what isn't, and what needs to be done to improve that. Well, I think a big key to consumer engagement is the relationship building. And that would suggest not just like a one-off, hey, share your story with us, and that's kind of the end of our relationship, or us kind of pinging you whenever we need you to participate in a press conference or something, but it's actually consistent and continued conversation with someone who took the time to share a story.
So I'm particularly excited in Virginia that after many years of working to educate policymakers, of talking, of lifting consumer voices, of working really closely with home visitors and community health workers who can share the stories of the families and clients that they work with day in and day out, that we were successful in advocating for a dental benefit across the lifespan in Medicaid. We really found a lot of success in amplifying community health workers and home visitors to share the stories of the families that they worked with.
In Arizona, we have affiliated practice dental hygienists. This is a direct access to care provider. And in our programs, we utilize that provider to the maximum that we can. What we've found is taking the dental hygienist out of the dental office and sending them out in the field, whether it be pediatric office, OBGYN offices, WIC centers, whatever that might be. It really makes sense. We kind of create this, I guess you'd say, is a hub and spoke type of model where we're able to get out and reach more folks where they're at. The hospital system that we're part of has a electronic medical record that does not yet have a dental component to it. So we've had to discover and develop different workarounds for that. And this is where we really do focus. We understand that dental services are good and screenings are good and preventive services are good, but what's better is really getting them plugged into a dental home and plugged into that medical home. So.
In California, we just completed the Dental Transformation Initiative program, which ran for 5 years here in the state. Really a focus in the Dental Transformation Initiative about the use of preventative services and continuity of care as well, and paying providers, incentivizing providers to ensure that continuity of care happens and that these preventative dental services are being offered to children.
Our National Rural Oral Health Initiative has not only produced different best practices and different compendiums of best practices, but have focused on policy research that has helped develop a rural-specific health interest. Our goal is to help elevate bringing care to where people are.
We have been talking for years and years, and research has been telling us for years and years that oral health is integral to overall health. Yet we have a system where when we work with clinicians and we get them on board about the importance of integrating all of those things, when they're talking to a patient and they're emphasizing to that patient the importance of that individual caring about their dental needs, addressing their dental needs, if that patient is not able to afford that care, all of that integration work it can't move forward because there's a really significant roadblock that isn't equitable, It's not meeting patients where they are, and it's making it impossible to address healthcare in its totality.
Well, I think the biggest problem, generally speaking, with the oral health system is that there are just way too many gaps, right? It's a patchwork of systems between, like, within the safety net system itself, and then there's a giant gulf that exists between the safety net system and private care. So how do we bridge that? How do we make it complete?
It's really, I think, reimagining the way the profession works together and the way we collaborate and redesigning that dental home. I know oftentimes we say, oh, everything for dental home, everything needs to happen in this one bricks and mortar building. And I would beg to differ, saying, we could get preventive services out in the field somewhere at a non-traditional setting.
We also need to think of bigger and think about how, like, if we could burn it down and rebuild it, what does it look like?
We're never going to get a complete sense of all of the problems that need to be addressed and all of the opportunities even that exist to, make improvements on these problems. So yeah, I think lifting up consumer voices is probably the biggest step we can take to addressing all of the gaps that exist in the oral health system.
I think that that's on us as advocates and as folks that are helping to navigate policy change to be sure that we are effectively translating stories, but we are also really respectfully working with communities in situations that we often think we understand but can't possibly fathom.
I would say at the heart of it, do anything and everything that you feel is important to relationship building.
Yes, if everyone's rowing in the same direction, then we get like this more person-centered healthcare. At least that's how I want to feel about it, is once we're in this person-centered healthcare system, we're all going down the same direction and we get to this better and more equitable system.
I used to teach dental students, and we would teach them public health and teach them interprofessional collaboration, but then we graduate them and they get out there and it's like, there's no job opportunities like that. We can teach them this in dental school, we can teach them this or inspire other hygienists to do this kind of stuff, but there just doesn't seem to be a whole lot of opportunities in it. We have to have systems change, right?
I feel really optimistic as we move into this new era. Really optimistic, because I think that people are well aligned in understanding that things need to change. And I think for the first time, I see a lot of consensus about where that energy needs to go. And I feel like there's great power in consensus and there's great power in optimism. So I feel really good.
Open blueprint for structural improvement.
The open blueprint for structural improvement.
A network approach to collective action.
Let's rebuild it.
Let's rebuild it.
Let's rebuild it.
Towards an equitable, affordable, and accessible oral health system that produces quality outcomes across the lifespan.